Hello and welcome back to TCTV On Location here at the Toledo Clinic. We're with Tim Taylor. He's a licensed physical therapist, and you're going to explain what needling is. I know some people may be uncertain about it. It's needles. Not everyone likes needles. Right. What is dry needling?
Dry needling is a relatively new alternative therapy available to patients through physical therapy now. Biggest mistake people think is that dry needling is acupuncture, and it's not. The fact that we're using the same type of needle that acupuncturists do, there's a lot of confusion about that. Dry needling is based on Western medicine techniques as compared to acupuncture, which is based on traditional Eastern philosophy. So there's a lot of confusion there. But it's been proven that dry needling can bring about a lot of pain control, muscle relaxation, and it has a general calming effect on the body.
So if a patient needs to ask some questions, what would you tell them would be the difference between the two, dry needling and acupuncture?
Well, usually with acupuncture, there's this idea that there's a disease state in the body and that there's this energy flow system that's interrupted. That hasn't really been proven. And the idea with traditional acupuncture is by putting needles in predetermined points, they can restore this energy flow and bring about a relaxed or what they call homeostasis. Simply, dry needling is not acupuncture. The dry needling of today is based on Western medical practices, whereas acupuncture is based on traditional Eastern philosophy.
So essentially, if somebody is uncertain or if maybe they're talking to their doctor, they should really refer to a physical therapist.
Correct. Right now, physical therapists in most of the states have been practicing dry needling for over a decade now. Unfortunately, a lot of the professionals in the industry still consider dry needling as acupuncture. So there's a lot of confusion regarding that subject.
So with dry needling, are there different types of A, needles, and B, types of dry needling?
Actually, the needles are essentially the same that acupuncturists use. I mean, there's different lengths, widths, gauges. It all depends on the person's body type, making sure we're using the appropriate ones. As far as different types of dry needling, there's three main types that we utilize here at the Toledo Clinic. There's one called the Integrative Dry Needling. That's very similar to an acupuncture session where we put the needles in, might leave them in for a few seconds, up to 20 to 30 minutes. People often say, that's acupuncture. Not necessarily. There's another form called trigger point dry needling where we use one needle at a time, where we actually are looking at concentrated areas. If a person has a knot in their upper neck area, we can actually use one needle and we can pepper that area to try to get that muscle to relax. And then the third form of dry needling is called Electro Dry Needling, is where we take advantage of using an electrical current attached to the needles, thus facilitating greater pain control.
Okay, you talked about it helps pain control, but is it painful?
Well, keep in mind, we are using a needle. The needle has a fine point, so on occasion, if we put a needle in, the patient might complain of a sting or a burn. We encourage the patient to let us know so we can reposition the needle so it's virtually pain-free. Now, the trigger point dry needling is uncomfortable. I mean, it's a very quick procedure, but there is some post-needling soreness that can last a day or two afterwards. But usually, the therapist here will determine which is the best technique for the patient.
Okay, so we actually have a patient who is willing to be your specimen for the day. Yes. So you're going to show us.
Yes. I can show a version of the integrative dry needling where the needles would stay in. I can show a quick example of the trigger point dry needling, and then we can just show how we'd attach the electrical current to the needles for electro dry needling.
Okay, so let's see.
Sure.
So this patient may have come in complaining about lower back pain?
Yes, low back pain, correct. Some patients, if they come in with herniated discs, generalized sciatica, we might start in the lower back and then maybe work into the buttock and the legs. But in this case, we'd probably use this type of technique for someone with generalized low back pain. So again, if we decided to do the integrative dry needling, we'd leave these needles in probably for, 20, 30 minutes. Other times if people can't tolerate or they're getting anxious with the needles in, we might take them out within a few seconds. From my experience, leaving them a little bit longer brings about more of a therapeutic effect.
And roughly how deep are the needles going into the tissue?
These needles in particular are about an inch deep, but again, it all depends on the patient. If the patient is thinner, we might use a smaller needle. If they're a larger patient and we need to go a little bit deeper, we have needles that go up to 4 inches deep if needed.
Wow. And what's the next step?
This would be a form of integrative dry needling. Now, if we wanted to do electro dry needling, we'd easily just hook up some alligator clips here to the needles. Patients who have used like a TENS unit or have had electrical stimulation before know what this is like, but because the needle is actually embedded into the tissue, the stimulation is a little bit more intense, a little bit more effective. And of course, we'd turn that on to the patient's tolerance. Now, the other version, trigger point dry needling, we'll demonstrate here, is a one needle at a time technique.
And for people who may have been concerned, there's really no blood.
Really, there isn't. The needles are so fine that they don't really leave a mark. Now, the only time we might run into a problem with some superficial bleeding is somebody that might be on a blood thinner. But again, we usually don't have any problems with excessive bleeding, but we do caution the patient that there might be some excessive bruising after the fact. So we'll kind of watch for that. Now, as far as trigger point dry needling, let's say this patient here had a deep knot right along the spine. We'd take one needle at a time. We'd put the needle in, and then we'd pepper the area, take the needle out, and then move on to the next spot. So the trigger point dry needling is very quick, but again, as I said earlier, you might have a little bit of post-needling soreness, no more than a day or two.
And so this is when you would have a really good conversation with your doctor and then working with the therapist to figure out which is the best.
Correct. Usually people that have a very low pain tolerance don't do well with the trigger point dry needling. It's a little bit more aggressive. So we usually like to start those type of patients with the integrative dry needling, which is gentler. People that have had chronic pain for years, they've tried everything else. Usually we might encourage the deeper needling, or it works well for athletes. So sometimes athletes will come in and say, listen, I need to get back into the game. I need you to give me the aggressive form. But we pick and choose what technique is best.
All right, well, thank you so much. That's all the time we have for right now, but we'll be back with more.